So the reason I study nutrition and lifestyle and how it affects outcomes in people with colorectal cancer starts back when I was a first-year fellow. I was looking for a research project. I was interested in both patient care as well as some type of clinical research. And it really started because I found a good mentor, Charlie Fuchs, who's at the Dana-Farber. That's his area of interest, is related to risk factors as well as factors that affect people already with colorectal cancer. I received a 2003 Career Development Award, and it was a 3-year grant to study specifically diet and lifestyle in colorectal cancer survivors. And that's really led to both having some protected time towards research and really led to the research that I've done over the last 6 years since that beginning of that award. The most interesting finding that I had from the research that was funded through the Career Development Award was related to the role of physical activity in colorectal cancer survivors, and then one study related to the role of diet in colorectal cancer survivors. The people who were more physically active after the diagnosis of colorectal cancer had a lower chance of colorectal cancer recurrence as well as overall survival. The second study that we've published is a single study looking at diet, and we found that people at a higher level of Western pattern diet had a higher rate of cancer recurrence and lower overall survival than those who had less of a Western pattern diet. And now recently received an R1 from the NCI using a lot of that preliminary data from that award to be able to continue to look at diet and lifestyle in colorectal cancer patients. So both the 1-year Young Investigator Award and the 3-year Career Development Award really allow both fellows and young faculty members to have protected research time as well as some resource to be able to do the research. In the last 2 years, I've mentored Nadine Jackson McCleary, who was a fellow at the Dana-Farber and now is a faculty member in our group. She received a 2008 Young Investigator Award. Her studies are related to how age affects people with colorectal cancer, and she has specific interest in geriatric oncology. And the reason I took on the role of mentoring her, even though it's a little outside of the area of my studies, is because of the importance of mentoring. The advice I have for young investigators is severalfold. One, and probably the most important, is to find a good mentor. So someone to be able to help guide you on what research would be of interest to you, as well as what may have impact in the overall oncology research world. The second is to be able to find something that really does interest you.